Hi everyone, this is Poornima. As you can see, I'm in Georgia, and at the back you can see there's a University Geomedi hospital, and I'm right now here. I'm going to see how the classes are conducted at the university hospital premises and how Geomedi students are having live exposure with the patient. So right now the schedule of Obs Gyne department is going on, and there's a class for fourth year students who are having practical exposure at the clinical. So there's a very big rumor going on in India that students who are studying in abroad, especially in Georgia, they're not having good clinical exposure. So I will just go inside and I will let you know how they are performing, how they are checking each and everything at the Obs Gyne department.
Okay, now perform the listening of the
Okay.
baby.
Then we are doing like listening, like we will find that the baby backside of that shoulder, okay, and we'll put like this, and don't put like pressure. Just and simultaneously we will look the pulse of maternal body, and if it is correlate, it will be wrong our assessment. It's not correlating. It is the right assessment.
These are the students from second year or third year?
These students are fourth year.
Fourth year students. Okay. So the regular rotation is going on.
Yes.
It's a great opportunity that they allow us to at least be in the operation room, which is a big thing for being a student. You know, exposure which we get here, and it's a good thing. And
So this is the department where the patients, the delivery is performed. So this is how the Geomedi students, they are having practical exposure on the patients live. As you can see, they are measuring the heart rate.
So this is our patient who's gestational week 36 weeks. She's hospitalized because of some kind of signs of preterm labor. So that's why she was hospitalized yesterday. And now we will perform her checking of the heartbeat to be sure that everything is alright and baby's doing good. And then we will check also contractions of the uterus. We can also perform the pulmonary relaxation of the contraction and the strength of the contraction also, okay?
Yes, ma'am.
Do you have any questions?
You uploaded in this one, ma'am, for heart, or you checked like where is the position of the heart of the baby?
Yes, as by just listening for the intermittent
Okay,
auscultation,
good.
the same we're doing. We're performing like examination, but it was performed yesterday,
Okay,
so I
that's why you know, yeah.
how the
Which side,
baby is
yeah.
lying and where is the position of the baby.
So I just came out from the hospital and we have shown you enough things and the exposure that the students are getting here in Georgia at the University Geomedi. As you have seen the entire hospital, which is very well equipped with all the facilities that the hospital should have. So they are having enough exposure. So this was just an example for one department classes. Similarly, they are also getting classes for cardiology and for the rest of the departments as well. Thank you so much.